You are dispatched to a scene for a 24-year-old with respiratory distress.
Okay. BSI scene safety. Is my scene safe?
Your scene is safe.
Okay, is this my only patient?
Yes.
This is a nature of illness call as I only have one patient. So based off of my patient's position at the moment, I will not be considering C-spine immobilization because she is in a seated position. I will consider calling ALS resources as this is a trouble breathing call. I will now move on to my general impression. My general impression is that I have a 24-year-old female with trouble breathing, seated in a tripod position. I will now check for AVPU. I can see that my patient is alert because she is seated and conscious. I will now check for verbal response. Ma'am, what seems to be the problem today?
I'm having some trouble breathing.
Okay, the patient is verbal and I have now checked for my chief complaint, which is trouble breathing. I will now move on to my ABCs. How is this patient's airway?
Patient is moving air well.
Okay, and now for breathing, I will check her respiratory rate. What's her respiratory rate?
24.
Okay, and I will now also listen for lung sounds. What do I hear?
Wheezing.
Because of this, I will consider administering oxygen through a non-rebreather at 15 liters per minute. Moving on to circulation, I will check for her pulse rate. What's her pulse rate?
Her pulse rate is present and steady at 96 beats per minute.
And how is her skin?
Her skin is warm.
Okay, so I will now assign priority. This is a priority patient, and I will try to transport her as history. How long ago did this start?
This started about 10 minutes ago.
Okay, and what were you doing when this started?
I'm just watching some TV.
Okay, and can you describe the feeling you're having right now?
There's like a tightness in my chest.
Okay, and on a scale of 1 to 10, can you describe this feeling? 0 being the least pain that you've ever had and you can breathe fine, and 10 being the worst that you can't breathe at all.
It's about 8.
Okay, and now that I've gotten OPQRST, I will move on to sample. Do you have any allergies?
I'm allergic to penicillin.
Okay, and are you on any medication?
Albuterol.
Okay, and do you have any pertinent medical history?
Asthma.
Okay, and when was the last time you ate?
I had breakfast this morning.
Okay, and I know you said that you were eating and you were watching TV before this started, right? History, I will now begin my secondary assessment. Has my patient's lung sounds gotten any better with oxygen?
Still wheezing.
Okay, and is my patient able to breathe any better with oxygen?
Breathing is a little better.
Okay, after my secondary assessment, I will now take vitals. What's my pulse?
90 beats per minute.
Okay, and what's my respiratory rate?
20 breaths per minute.
Okay, and what's my blood pressure?
112/70.
Okay, so after taking vitals and getting my secondary assessment, I can make my field intervention. I believe that my patient is having an asthma attack, and so I will help her by administering some albuterol. I will check after helping her take albuterol. I will check her vitals every 5 to 10 minutes to see if anything has changed, and then I will begin transport.